Mrs. Jones. How are you doing? My name is Binui. I'm gonna be your CNA for today, okay? I'm gonna help you uh, clean your genitals. I'm gonna go get my supplies and I'll be right back, okay? Perform hand hygiene. Gather my supplies. I'm going to get water in both basins, warm water. I'll test the water, the back of my hand, and I'll get it into the basins. Then I'll have the patient test the water. Mr. Jones, can you test the water? Just make sure it's the right temperature for you. Okay. Okay, Mrs. Jones. I'll put on gloves. I'll raise the bed to my waist level. Okay. I have my gloves on, guys. My back blanket. Take off that other blanket. Roll it down to the foot of the bed. And I'm gonna expose the peri area. Because that's the only part I need. We only expose the parts that we need to work with. I'm gonna have one of soap and the other one was gonna be clean water. I'm gonna take the one with soap, the water with soap. I'm gonna squeeze it, fold it into 4, and I'm going to clean the peri area from front to back. I'm going to start with the middle part. Fold the washcloth, clean one side of the labia, fold the washcloth, clean the other side, fold the washcloth, and I'm gonna, and this I'm just gonna put it right here. I'm gonna take clean water with no soap, fold the washcloth into 4. I'm going to rinse all the places I washed. Fold the washcloth one side of the labia, and the other side with the new side of the washcloth each time. And then always use a new side of the washcloth with each wipe. And I'm going to use my towel right here to pat dry. I'm gonna pat dry. And then I'm gonna have new washcloth for Mrs. Jones. We're gonna roll you over on your side so we can clean your buttocks, okay? I'm gonna put your head flat so it'll be easier to roll. Okay. Gonna lift one leg legs wide open. I'm gonna roll you towards the side with the side rail. Making sure you're comfortable. Gonna make sure you stay covered. I'm gonna take the soapy water. I'm gonna clean that way for the washcloth and everything. And I'm gonna get another washcloth for rinsing. Squeeze it, fold it to 4, and I'm gonna rinse. And I'm gonna pat dry. If this is wet or dirty, I'll roll it over and put a new one. But if it's clean, I will just roll the patient back. Okay, Mr. Jones, let's come back. All right, you're all clean. This goes in the dirty hamper. Or it just goes in the dirty hamper. Jones, I'm gonna put your bed down. You want your head up? Okay. Tell me where. Okay. Okay. Yes, your call light. Set it down. I'm gonna empty this in the sink. I'm gonna rinse the basins and dry them with paper towel. Empty, rinse, dry with paper towel. We never store any basins that are wet because that's giving room for bacteria to grow. And all of this goes in a dirty hamper. So we disinfect the table. Disinfect the table. And then is there anything else I can do for you, Mrs. Jones? Okay, let me know if anything comes up. You want your light off? Okay. From hand hygiene, open the curtains, turn off the light because Mrs. Jones asked for the light to be turned off.